Hello, my name is Samantha Robinson. I'm a case manager here at UTMB, Galveston. I wanted to talk to you today about our program, the Ryan White specifically program. We handle a very small portion of the clients that are afflicted with HIV here in the Galveston and general area, but it's a very important job of what we do. So I'm just going to bring you through a day in the life of a person afflicted with HIV and how they come into care and navigate through the system. Okay. All right. First thing we're going to talk about, it is very much more than medication. It's not magic. It takes a team approach to actually get a person into care, treat them, navigate through the system, and keep them in care and get that viral load suppressed. Part of our team here at UTMB, and again, this is a model. Part of our team here at UTMB, we're made up of 3 case managers. We have several data entry personnel and coordinators in care, and we have 1 person specifically in regards to medication. And that, again, it is strictly Ryan White based. What we do, we will get a person that we've been notified, and for instance, we get them from the health department. We get people referred to us from all walks of life. There'll be self-referrals. There'll be people who just had a rapid test done at a bar in the local area. There'll be most of our people come from the health department or referred to us. We work very closely with the health department. In addition, we get some that are newly diagnosed in the hospital setting. In this area, it's a very big transit area, so we'll get a lot of people that are moving to the area. They've been out of care for several years, or they're just transferring care from a different location that's Ryan White affiliated or different part of the country. What does a newly diagnosed person look like? And again, when I was doing this presentation, I'm not a speaker by trade, so I had actually one of our medical students helping me put slides together whatnot, and I was first talking about facts and figures, and he said, please, Sam, do not do any facts and figures. He said, you're going to put people to sleep. So this is going to be your only facts and figures slide and talking from me. Anyway, what does a newly diagnosed person look like? This is actually a slide from the CDC, and it just talks about nationwide, and the last date was, I believe, from 2015 overall, who gets diagnosed. I can tell you here in our area of the Galveston and 3-county area, because we cover 3 counties for our Ryan White grant. We cover Matagorda County, Brazoria County, and Galveston County. The newly diagnosed person comes from all different walks of life. We have upper middle class, lower class, you name it, we have it. Now, we pay special attention under case management for the homeless, for the people with substance abuse, mental illness, dysfunctional families, history of abuse in their family, transgender. They are our most vulnerable and special populations. So everyone is offered case management, but we really hit home and try to retain them into case management, not just provide them care, but also give them the support and the network that they need to be successful in our program and succeed in care. Now, the newly diagnosed person, I can tell you in this geographical area, it's been, and everything changes, but in the last year, our younger population, and I'm talking 18 to ages 27, 28, has exploded. Okay, last month alone, 2 years ago, we would have on average maybe 1 to 2 new patients a week. Last month alone, we had 39 new clients that came through the door. And I would say at least 25% of them were from ages 19 to 27. The other special population that we really focus on are women. Women historically are the caregivers of their family, and unfortunately, they're the last ones to take care of themselves. So those are the people we find that are falling out of care and at most at risk for falling out of care. So those are the ones that we really try to give them a case manager and become their support network. The Ryan White program, and the way we look at it and the way we train each other, because nurses train nurses, And that is one thing special about our program here at UTMB is the case managers are all registered nurses. We also have just hired a support person that is going to be our linkage to care, and she is an LVN. But for the most part, our case managers are all registered nurses. When you look at other models around the state and the country, most of the time they are social workers. But we have a different component to it where we're putting medical along with psychosocial together to incorporate to give them a more rounded of what we're looking at care and treatment. At any given time, we show different parts. We wear many hats as a case manager. What we're looking at is we are their sister, their mother, their whole support network. We provide them, we're their disciplinarian, their life coach. I mean, you name it, we are that person for them. The person coming into Ryan White Care is very vulnerable. They're scared. They're at their weakest point in life. You're never going to see them more beaten down. They are angry in some cases. They are ashamed. They are very scared, and they need our help more than any other time probably in their life. A lot of these people have never been in healthcare before in the healthcare system. We have to take them from point A to point Z. When you think about our newly diagnosed person, it's not a person who is 50 years old and 60 years old that is getting HIV. It is the ones that are 24 and have never had to go to a pharmacy before. They don't even know how to get up medication. They don't know how to make a doctor's appointment. They've had someone in their life always doing that for them as a pediatric person, and now they're expected to grow up, and they've been diagnosed with a chronic disease that they don't know how to handle, and there's a stigma attached to it. So in a lot of cases, we are their only support, and we've got to take them by the hand and bring them all the way through the system to hopefully successfully bring them and keep them in care. So what does a Ryan White patient look like? The way I look at it when we're working with the nurses is it's a combination of we're doing the 12 steps of Alcoholics Anonymous with them and along with Kubler-Ross's model. You're bringing people through, they are in denial, they are angry, they are bargaining, they are depressed. I would say 99% of the people who come in are depressed, and that is one thing that we do offer is we offer services for psychiatric treatment in our area. And I would say at least 50 to 75% take us up on it. They may not follow through with it in the long haul for psychiatric treatment, but at least we'll get them through the time where we can get them care and treatment and they get an understanding and some education of what it involves, because a huge part of what it is education and getting rid of the stigma, not only of the patient, but then of their support group too. How we teach people, and again, it is all confidential stuff where we're talking behind closed doors, because for the first time they're having to lay across the line and tell us every dirty thing that has ever happened in their life. They've got to tell us about their sex life, their risk habits, their drug abuse, you know, what their thoughts are, their affiliation. Are they gay? Are they not gay? I've got to find out from them, you know, what type of doctor they would be more comfortable seeing. I have all different personalities that we're dealing with when it comes to patients, along with physicians. I might have, for instance, I might have a patient and they're an analytical thinker. You know, I've got an engineer sitting in front of me and he's black and white, and he is not the touchy huggy person. He wants black and white. He wants concrete information from me. So in turn, I have to give him a doctor that I'm thinking is going to be the appropriate one for him, that is going to relate to him on his terms. For instance, at our program, we have a PA. For the PA, and for anybody who knows our physicians, you'll understand this. For the PA, I always give him the hypochondriacs, okay? Because I know those people are going to, you know, as soon as they find out they're diagnosed, and we go through opportunistic infections as part of the education program, all of a sudden, even though they have a very high CD4 count and they've shown no sign of illness, they also have strange rashes and they get a sore throat and everything. So we see those people often. Since I have a PA in the office, I know when I've got my hypochondriac client that I am able to get him some satisfaction because I can get him in any time to be able to see this PA and give him some peace of mind. Okay, I also have my engineer, so I know there's a certain doctor. His name is Dr. Blanton, and he is straight and to the point. We'll get them in and get them out, and our patients do very well with Dr. Blanton. When my patients, when I have a patient and they need a superstar, they need somebody that's going to make them forget that they've got HIV, then I'm going to give them to Dr. Kaiser. Okay, because Dr. Kaiser, you walk into the room and forget I have HIV. It's all about Dr. Kaiser and what kind of show is he putting on, So I have clients that beg me to put them with Dr. Kaiser because it becomes more entertainment and they're, entertained for their half hour or their hour. And then they bring their parents with them, which is a great thing because, you never see anybody, but you'll see a whole family come to see Dr. Kaiser. The people who need the compassion, who need their hands held, okay, or who have complex medical needs, I will put them with Dr. Ute. So it's a special art to be able to do this, okay? And then we have one who, these are my special individuals that even though they're 3 hours late for their appointment and they come a day late or a day early, or they haven't been in care in 5 months and we're getting ready to give up on them, all of a sudden they just show up in the clinic. We have Dr. Premal Patel. She will not give up on anybody. She'll go to your house. She'll do everything. So I know that for those special clients, those are going to go to Dr. Premal Patel. So it's a definite art to what we do. It's a lot more than medication because all this happens before any medication ever hits that patient's mouth. Okay? All right. So getting into our program, we get the referrals from all different sources. Again, the health department, we get them from an organization here in Galveston called ACCT, Access Care of Coastal Texas. What they do is they provide linkage to care services for clients throughout the 3-county region, and they provide us with transportation. They have a food pantry, a clothes pantry, free lunches, shoulder to lean on. They are your champions. Okay, we work hand in hand with them. We do the medical side of the house. ACCT takes care of the linkage to care and just keeping people in care, and assistance with housing is another area. So under diagnosis treatment, just so we're all on the same page, we don't make this stuff up. We have something that comes from the state, which is called our standards of care. So that is our Bible that we follow on a yearly basis, telling us these are the standards of what we need to do to keep people in care. It gives us our guidelines, per se. So this is as part of the standards of care, and it tells us from diagnosis to treatment, when we bring people in, do they fit any of the criteria in the middle? If they fit anything in the middle, it's always a yes. We want them to be a case manager. Again, they don't have to be, but when we show them the services that we can provide to them and we bring them along, it's all part of how we sell it to them. Okay? How we bring it through, 9 times out of 10, they're going to tell us they want a case manager. We don't expect, it used to be, again, he talked about where it's a paradigm shift and changes happen all the time. That's exactly what happens with us. It used to be where you had a case manager and you had a case manager for life. As long as you were in Ryan White, you were kept on case management. Anymore, we are bringing people through the system, navigating through, overcoming all the barriers to care, providing them education and life skills that they can handle their health care on their own. And if that's the case, then we graduate them. And at that point, all we do is help them pay the bills. Whether we are just covering them under Ryan White and we pay for their HIV care, or we refer them if they have jobs and they're making over 100 percentile over the federal poverty limit, we're able to assist people to obtain Affordable Care Act insurance. So we're doing really great things, and changes happen all the time. So on any given day, we never know what's going to happen as far as insurance or not insurance, or who's insured or not insured, or what's going to happen. But we always try to give people a safety net to tell them, no matter what, Ryan White is going to be your support network, and we will take care of you. Either way, we'll find a way. Now, under this, we have over 150 referral sources throughout the 3-county area. So it's not just about us or ACCT. It takes a team to take care of all of our patients. Now, when they go from diagnosis to treatment, again, when they're enrolled, when you're enrolled for 6 months to a year at a time. Okay, we're getting you. That gives us enough time to get you into the system, overcome all the barriers, and then we're also looking at, as soon as possible, when you're ready for it, because we're going through Maslow's hierarchy of needs. Okay, so the more intense you need case management, the more case manager you're going to get. I get some that all I do is make their appointments, and then I check in with them on a 3-month basis just to make sure that they got everything that they need and they understand stuff. And then on the other end of the spectrum, I have clients that I call every day and ask them if they took their medicine. We have one client, a special client right now, and he gets a 2 to 3 o'clock wake-up call in the afternoon because he oversleeps. So just to make sure that he's taking his medicine, he's getting care, and he's out looking for a job and trying to find stable housing, we are his mother in that case. Okay, so on average, they're enrolled. We do biweekly contact. We assess at 3 months. So what we're looking at is at the 3-month point, that's our target to say, are they on medication? We want everybody on medication at the very latest by 3 months. That gives them enough time to get into the system, see their doctor, apply for medications, and get them on the road to wellness. On the other spectrum is, if they don't meet any of this criteria, it doesn't mean you can't have a case manager. I have a lot of long-term people, and they'll move from other areas, and they're like, what do you mean you're telling me I don't have to have a case manager? Okay, because a lot of people, that's all they know is I have a case manager that has been running my case. That's not the case anymore. I have people, if they're self-sufficient and they've been diagnosed since the 1980s, they can teach me how to handle HIV. I don't necessarily need to teach them anything. All I have to do is be their instrument to help them into the healthcare system. So we have no on the right side, on the side here, which brings them to where we're just covering them under Ryan White. They're still required to show proof that they live in our area, that they fall under the qualifier, which is under 300% over the federal poverty limit, to stay in our program. But again, they're only in our program. They're not actively being case managed. And that is where our new navigator through our LVN is going to come in, because she's going to be their big sister watching over their shoulder in case they need anything. Do y'all have any questions for me? Because that's pretty much it.